Hi, I'm Dr. Jen Parsons, naturopathic doctor, and today I wanted to share a bit of a PSA about vitamin D. So I have a lot of patients asking me about vitamin D. They're hearing that it's good, that maybe they should take it. So we do know that vitamin D is great for bone health, for teeth health, for your immune system. If you have an autoimmune condition, it's good for your heart. It's good for hormones, and it's great for mood as well. What we do also know right now is there is a high correlation with low vitamin D levels in patients with COVID and poor outcomes, including death. So that is why I think it's a really important topic right now. So first of all, I wanted to talk about different kinds of vitamin D. So there are lots of different kinds. There are capsules, there are tablets, there are liquid. So my personal favorite is liquid because it's a fat-soluble vitamin. It's really important to take it with a fat, and when you're taking it with liquid, it's already there for you, especially the emulsified kind, because then it's even more bioavailable. So these are a few that I like. I like Genestra's Demulsion is really great and tastes delicious. Kids love this one. NFH has a great vitamin D. And this one is great as well because it has vitamin D and K2. So I want to talk about that a little bit as well. There are sometimes you'll see D2 or D3. So when we're looking at the difference, D2 is a lot cheaper to make, but it's not very well absorbed in the body. So you want a vitamin D that is, first of all, liquid. Second of all, D3, because that's the kind, that's the vitamin that your skin is actually producing when the sun hits it. So even better, if you can find a D3 with K2. So vitamin K is an essential vitamin to help you with blood clotting, but when you take it with vitamin D, it helps calcium absorb into the bones and keeps it from being too dangerous because you don't want a lot of calcium floating around your blood. So the K2, the vitamin D helps make calcium and then really help drive it into the bones is the K2. So those are the kinds that I like. And now as far as how much should you take? That is a good question, and everyone's needs are a little bit different. But here are some things that you need to consider that cause lower vitamin D levels. So the first one is where you live. So anyone who lives north of 37 latitude, which is, spoiler alert, everyone in Canada probably is getting lower vitamin D levels, especially in the winter for obvious reasons. Another risk is as you age. People who are over 65 make about a quarter of the amount of vitamin D from their skin as someone in their 20s. So number 3 is skin color. So the darker your skin color, the less your skin is going to be able to absorb vitamin D most likely, and typically we find lower levels of vitamin D. The next is what foods you eat. So there's certain foods that are high in vitamin D like fish, fortified dairy products also have vitamin D in it. So it just depends on how much you're taking, and if you've had to eliminate dairy for one reason or another, then you might need to supplement as well. Health conditions can prevent you from properly absorbing vitamin D, like IBD, liver conditions, or cystic fibrosis can all keep you from having your optimal levels. So that's it. I can't give you exact dosing because everyone's a little bit different, but I do suggest talking to either your medical doctor or your naturopathic doctor about having your levels tested so you can get the right dose for you. Take care, everybody, and stay safe.